Hi everyone, welcome to the Autoimmune Dietitian YouTube channel. My name is Annie. I'm a registered dietitian and I work with people struggling with autoimmune diseases. So in my work with my clients, I help them use both food and lifestyle as a way to improve their symptoms and give them their lives back. So May, if you're watching this as it's getting posted, it's May, and May is also Lupus Awareness Month. So I thought it'd be a perfect time to highlight this autoimmune disease. Lupus affects 1.5 million Americans and 5 million people worldwide. It's an autoimmune disease that attacks all body tissues, including organs, skin, and joints. Lupus can be really difficult to diagnose because it can cause inflammation in any part of the body, and as many of the symptoms mimic other diseases. So today I'm covering what lupus is, how it is diagnosed, how it's treated, and what alternative therapies exist. So before I jump in, I need to attach a disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or cure of disease by a medical provider. This is for informational purposes only. So please consult your qualified health professional for any changes you make to your medical care. All right, so what is lupus? Like I said, it's an autoimmune disease and attacks the healthy tissues in the body. And there are 4 different types of lupus. The first one, which is the most common, is systemic lupus erythematosus, or SLE. It's the most common form and can cause widespread damage to the body. The second is cutaneous lupus, which is where the immune system attacks the skin only. There is drug-induced lupus, which is a disease that acts like lupus but is caused by certain prescription medications. And then neonatal lupus is the 4th type of lupus, and it's a rare form of lupus that affects the infants of women who have lupus. So like all other autoimmune diseases, lupus tends to affect women more than men. In fact, 9 out of 10 people with lupus are women. This autoimmune disease disproportionately affects certain racial and ethnic groups, including African American, Asian American, Hispanic, Latino, Native American, and Pacific Islander. Lupus also tends to be genetic. So those who have family members with lupus are at a higher risk of developing the disease. In addition, researchers also believe there are common triggers to lupus. These include hormones, including estrogen, and environmental triggers. So how is lupus diagnosed? So since it can affect the entire body, this autoimmune disease can be really difficult to diagnose because it has a large subset of symptoms. Some people experience extreme fatigue, joint pain, or what is known as a butterfly rash on the face. Others may develop a sensitivity to light, have swelling in the hands, feet, and around the eyes, or have hair loss. So lupus takes on average about 6 years to diagnose from the time that the first symptoms pop up. And there's no single test for lupus, which again makes it really difficult to diagnose. At your doctor's visit, they will review your medical and family history and do a physical exam. The one blood test that is commonly run is called the anti-nuclear antibody test, or ANA. It determines if your body is likely to make autoantibodies of lupus. However, a positive ANA does not mean that you have lupus or even an autoimmune disease at all. There are a handful of other blood tests that look for other antibodies in the body that make them when lupus is present. If the skin or kidneys are being affected, you may have to undergo a skin or kidney biopsy as well. So what about treatment? The goal of lupus treatment is to prevent flares and to minimize organ and tissue damage. So there are a handful of conventional therapies that help lupus patients. These include, and I'm going in the order of least invasive to most invasive, NSAIDs, or non-steroidal anti-inflammatory drugs, which help lower mild pain and swelling. These would include things like Aleve, Advil, naproxen, to name a few. The next line of defense are corticosteroids like prednisone. Again, these are really strong anti-inflammatories that are meant to be used for short-term flares. Then there are anti-malarial drugs. So these are drugs that treat malaria, and they also help with joint pain, rashes, fatigue, and lung inflammation. So examples of these include Plaquenil or hydroxychloroquine, or chloroquine phosphate, also known as Erelin. Then there are something called BLYS specific inhibitors. These drugs limit the number of abnormal B cells that you find in people with lupus. So B cells are the part of the immune system that make antibodies. And so this drug tries to limit the amount of B cells there are so your body doesn't make antibodies against your own tissues. There's one common drug that fits this category. I can't even pronounce it. I believe it's called belimumab, but that is the one that is most commonly used. And then lastly, there are immunosuppressants. So these drugs are used with severe lupus cases when organs are being attacked and no other options seem to work. What's awesome that's coming, a lot of research has been done, or they're starting to do a lot of research on, is a new treatment called CAR T therapy or CAR T cell therapy. A study that they did on 15 patients, 8 had lupus, did receive this type of therapy. And there are other diseases included in that study, but the people with lupus, or what's known as idiopathic inflammatory myositis, which attacks the muscles, they saw complete resolution of their symptoms and have maintained remission for at least 2 years, which is pretty remarkable. CAR T cell therapy is currently used for cancer treatment, certain cancer treatments, but they are exploring it for the use of, these specific autoimmune diseases as well. There are clinical trials going on right now. If you Google CAR T cell therapy and, clinical trials, you could possibly qualify and sign up for one to see if you are in the study, maybe you will be able to get the drug tried on yourself. So what are some alternative therapies to help manage symptoms? So medications do wonders for people. I am not an anti-medication person. I think they can work really well in conjunction with alternative therapies. And there are a few alternative therapies that can help relieve the symptoms of lupus. So here are a few options, or things you should just do in general if you do have lupus to try to, manage your symptoms. The first is being really careful about sun exposure. So sunlight can trigger flares for some people with lupus. And if you avoid the sun, it's incredibly important to take a vitamin D supplement. Vitamin D levels in your body are indirectly proportional to disease activity. So the lower the vitamin D, the more active your disease is. The higher the vitamin D, the less active your disease is. So how much should you supplement with? That's always kind of the big question. That depends on your vitamin D level. So you want to ask your doctor to get that checked, and you want to monitor that level throughout the year. Your optimal level is somewhere between 40 to 50, ideally 50. That is where, the disease activity starts to slow down. It also lowers your risk of developing breast cancer and cancer in general. So 50 is where it's at. The next thing you want to do in terms of diet is avoid eating garlic. So according to the Johns Hopkins Lupus Center, garlic can stimulate the immune system, causing it to be overactive. And with overactive immune systems, that can lead to flares. So try to avoid cooking with garlic or eating foods with a lot of garlic. So in reality, a little bit here and there is probably fine, but just be mindful of your garlic intake, and also, notice if you are affected by garlic. So, eating garlic may cause kind of underlying chronic inflammation for you. If you take it out, maybe you feel better. It's a good thing to experiment with. You also want to avoid alfalfa sprouts. So these sprouts contain an amino acid called L-cannabinine, and that has been shown to trigger inflammation in people with lupus. The last dietary thing I'll mention is focusing on whole foods. So as with all autoimmune diseases, eating a nutrient-dense diet can really go a long way in fighting inflammation. So focus on whole foods, mostly plants, for nourishment. I know there are a lot of people who do follow a vegan diet with lupus. I'm always very careful about vegan diets because in a lot of cases it can lead to some deficiencies in protein, and then a lot of times people do feel worse after a period of feeling great. So just be careful if you are vegan, making sure that you're getting adequate protein sources. Also important to note that lupus can attack the kidneys, which may require special dietary guidance because of the kidney's role in filtering out certain minerals, vitamins and minerals. So if you are, experiencing some kidney issues with lupus, please seek help from a qualified registered dietitian familiar with renal nutrition if you are having issues with your kidneys. There are a handful of supplements that can help lower inflammation that have been studied for lupus. Omega-3 fatty acids, turmeric, and ginger may also be really helpful. Vitamin E has been used to support cutaneous lupus. And then anything to lower stress is really beneficial. Living with a chronic disease is stressful, so the more you can do to lower stress, the better. Doing meditation, bodywork, yoga, so forth. And then one more thing to mention in terms of like supplements and herbs that you do want to avoid is echinacea. So echinacea is usually used to support the immune system. A lot of people use it when they are feeling sick. Echinacea may cause flares for people with lupus, so you want to be really careful about using that. So today we focused on lupus. It is Lupus Awareness Month. It's always good to bring awareness to all of these autoimmune diseases, to drive more funding to research, to help develop cures or medications and things to hopefully put people in remission. If you would like more help managing your autoimmune disease, whether it's lupus or something else, I would love to chat with you. I offer free discovery calls to learn about your goals and to see if I am a good fit for you. So you can go to the link in my YouTube profile to sign up for that. While you're there, check out my website, annieRubin.com. I've got lots of great material there. I have an extensive blog. I have some free materials that you can download. And then lastly, I put out a newsletter every Thursday. The link is also in my YouTube profile to sign up for that. Lastly, if you enjoyed this video, please hit the little follow button and subscribe. These videos come out about every week, always mentioning something about autoimmune diseases and lifestyle and nutrition and how you can kind of blend all of that together to feel better. So thank you so much for joining me, and I will see you next time.